And that's not a criticism of modern science. It's a reminder that human knowledge has never moved in a straight line. Long before hospitals, laboratories, and medical degrees, ancient civilizations developed healing systems that worked, sometimes better than the medicine that followed centuries later. They didn't have microscopes, they didn't understand bacteria, yet they saved lives in ways that still confuse experts today. Ancient medicine was not guesswork. It was observation, repetition, and experience passed down across generations. If a treatment failed, people died. If it worked, it survived. In ancient Egypt, doctors specialized. Some treated eyes, some treated bones, some treated internal diseases. Medical papyri describe symptoms, diagnoses, and treatments with surprising clarity. Wounds were cleaned, dressings were applied, infections were reduced, patients recovered. Modern analysis of mummies shows healed fractures, repaired injuries, and surgical scars that closed properly. These people lived long after treatment. Meanwhile, early modern medicine in Europe often caused more harm than good. Bloodletting weakened patients, mercury poisoned them, leeches drained what little strength they had left. Doctors meant well, but lacked understanding. Ancient surgeons in India performed procedures that wouldn't reappear in Western medicine for over 1,000 years. They repaired noses, removed tumors, and treated internal injuries. Surgical texts described instruments, angles, depth, and aftercare. This was not primitive medicine, this was systematic healthcare. In the Andes, ancient civilizations practiced trepanation, drilling or cutting into the skull. At first glance, it seems brutal, but skulls show clean edges and signs of healing. Some patients survived multiple procedures. How did they prevent infection? How did they manage pain? We don't know for certain. Ancient doctors didn't treat illness as isolated symptoms. They treated the entire person. Diet mattered. Environment mattered. Mental state mattered. Ancient Chinese medicine mapped energy pathways through the body. Modern anatomy does not recognize these pathways, yet acupuncture consistently produces measurable effects: pain relief, reduced inflammation, improved circulation. Science can measure the result, but still struggles to explain the mechanism. Herbal medicine presents another mystery. Ancient healers combined plants in precise ratios, not randomly, intentionally. Modern pharmaceutical research has discovered that many ancient remedies contain active compounds used in modern drugs. Some ancient mixtures work better together than isolated chemicals. Ancient doctors understood synergy long before modern chemistry named it. Pain management in ancient medicine is deeply misunderstood. Plant-based sedatives were used to calm patients before surgery. Some induced deep sleep-like states. Others reduced awareness and pain. These were not accidents. Dosage mattered. Timing mattered. Recovery mattered. Ancient physicians documented side effects and dangers. They understood risk. In ancient Greece, medicine was grounded in observation. Doctors recorded symptoms over time. They tracked outcomes. They adjusted treatments. Hippocrates is remembered not because he guessed, but because he watched, measured, and learned. Ancient Roman medicine focused on sanitation in prevention: clean water, public baths, sewage systems, fresh air. While later societies ignored these lessons, Rome reduced disease by design, not medicine alone, but infrastructure. Ancient medical knowledge was often tied to philosophy. Health was balance. Illness was imbalance. Treatment aimed to restore harmony, not just suppress symptoms. Modern medicine is only now rediscovering this approach. So why was this knowledge lost? Empires fell. Languages vanished. Medical schools burned. Doctors were killed or scattered. The Library of Alexandria may have contained centuries of medical research, treatments tested across generations.
Methods refined through failure and success. Gone. What replaced it was not progress, but confusion. For centuries, medicine moved backward. Superstition replaced observation. Authority replaced evidence. Doctors followed tradition instead of outcomes. It took hundreds of years for medicine to relearn lessons ancient doctors already knew. Today, modern doctors study ancient practices again, not because they reject science, but because science demands results. Ancient techniques are being tested under modern conditions. Some fail, but many succeed. And some succeed in ways we still can't fully explain. The most uncomfortable truth is this: ancient people were not less intelligent. They were differently intelligent. They studied nature instead of machines. They learned through survival, not theory. And when something worked, they remembered it. Human history is not a story of constant improvement. It is a cycle of discovery, loss, and rediscovery. Modern medicine is powerful, but it is not complete. And the past still has lessons we haven't finished learning. The greatest medical mystery isn't what ancient doctors knew. It's why we stopped listening for so long.